This was a phase 2 study of Tipifarnib, which is a farnesyltransferase inhibitor. It's an oral drug. Actually, it's an old drug that was used a number of years ago for solid tumor patients that had RAS mutations. Recently, a phase 2 study was conducted by Dr. Witzig, which showed activity of this drug in different types of lymphoma, particularly T-cell lymphoma. In that study, Dr. Witzig reported a 50% activity for Tipifarnib in T-cell malignancies. So based on that very encouraging information, this current phase 2 study was designed. It was designed to look at efficacy, but also more importantly, to try to identify biomarkers of response. The drug was given daily. Initially, it was 2 weeks on and 1 week off, and then 3 weeks on and 1 week off. And in this current study, 65 patients with relapsed and refractory aggressive T-cell lymphomas were enrolled. There were 38 patients with angioimmunoblastic T-cell lymphoma, 25 with peripheral T-cell lymphoma NOS, and the rest were other subtypes. The median prior treatments was 3. In fact, 43% of patients had had a multi-agent chemotherapy regimen prior to receiving Tipifarnib on this study. The overall response rate was 40%. It was 56% in angioimmunoblastic T-cell lymphoma, and it was slightly lower in peripheral T-cell lymphoma NOS. Most of the patients responded within 4 months of dosing, and the median duration of response was 3.7 months. However, in AITL patients, it was 7.8 months. There were 2 patients who remained on treatment, and in fact, I have one of those patients in my clinic. She's been on the drug now for several years, and she remains in remission. The major side effects were cytopenias, bone marrow suppression, which occurred in up to 40% of patients. Dose reductions were allowed in the study for those patients that needed it. And also, there were some patients who developed nausea and diarrhea. One of the important aspects of the study, as I mentioned, is to try to look for biomarkers predictive of response. So mutational analysis was done on the tumors. It was found that tumors that had epigenetic mutations, specifically RHO-A, DNMT3, and IDH2, had a higher chance of responding than those who didn't have the mutations. In addition, TET2, another common mutation, didn't appear to be associated with response. In the course of the study, only 6 patients died, and none of those deaths were study related. So overall, Tipifarnib in this study was a very active drug, even in patients with multiply refractory T-cell lymphoma. And the biomarker study, as well as the clinical data, indicated that the drug is more active in the follicular helper subtype angioimmunoblastic T-cell lymphomas. My patient is an elderly woman in her mid to late 70s who had multiple treatments for her aggressive T-cell lymphoma, including an autologous stem cell transplant. She then progressed. And at that time, she wasn't really a candidate, nor did she actually want to go back on multi-agent chemotherapy. So we discussed this clinical trial, and she entered the trial. Fairly early on, within the first 4 months, she actually had a complete response that was documented by PET scan. She had virtually no toxicity from the drug, and she's continued to take it as per protocol. This protocol has an expanded access arm that allows patients like mine to continue on the drug now that the actual protocol has been completed. So this lady is now on treatment. I believe we're going on close to 4 years, again, with no toxicity, and she remains in a complete remission. It's very interesting that an old drug like Tipifarnib has now been shown to be active in a particular subset of T-cell lymphomas. As we move the field forward in aggressive T-cell lymphoma, we're now starting to pay more attention to the mutational analysis and therapies that are specifically directed towards specific subtypes, such as angioimmunoblastic. So I think this drug is very interesting in that it has really demonstrated strong activity there in that subset of patients. And we have these biomarkers as well. We are hoping now to further develop tipifarnib and similar drugs and look at potential combinations and how we could sequence these drugs in with existing therapies.